Welcome to NTN, Nurses Take Notes, a place where nurses can gather and take notes on the things you may not know. This video is on administering medication. When administering medication, you must know how to give it. This helps reduce errors. There are no room for drug errors. Number 1. The right drug. It is important to read carefully and check the spelling of the drug you are about to give/use. Drug name can be hard to pronounce and difficult to read. Drug names can sound and also look alike. Check with pharmacy or a reliable source if you're unsure. Number 2. The right time. It is policies that you should go by where you work. You should have an order to tell what time you should give the medication. In order for some medication to be effective, it has to be given at the correct time of day, evening, or night so that the level of medication is constant in the body systems. Number 3. The right dose. The dose for a child isn't the same as an adult or a geriatric person. The medication would require a small or large change depending on patient's weight or sensitive to the medication. To give the proper dose may also require to use appropriate equipment or form of drug, such as scored tablet or syringe/measuring cup. Number 4. The right patient. Having the right patient is very important to avoid medication errors or death. You may have to confirm the identity of the patient by asking the patient their name and date of birth or reading the wristband. There are some patients that can be at risk, which are non-English speaking, confused, or critically ill and pediatric. Kids may hide, answer by other names, and change wristbands/beds. Medication should never be given to a patient that's not wearing a wristband or ID badge. Number 5. The right route. The route is in a way of which the medication can be taken into the body. You have oral, which is the preferred way if the patient is awake and able to understand. The most fastest way medication can enter the bloodstream is in intravenous or intramuscularly. Nebulizer is an aerosol, is like a mist that is given by nose or mouth. You would also have eye/eardrops, topical through the skin ointment, lotions, shampoos. Some medications can also go through the vaginal and rectal area. Number 6. The right documentation. Keeping record is a good way of knowing and telling what was done in the absence of another nurse. When you document, you should always tell the truth. Always record the medications that was given or before they was given. Never give medication prepared by another nurse. Progress notes should include what medication and how the patients tolerated the medication and also any adverse reaction that may have occurred. Always remember, if you didn't document it, it didn't happen. Thanks for watching. Did you take notes? Please comment below, like, share and subscribe.